Hello and welcome. Today we are going to get into a topic that is, let's be honest, incredibly frustrating for so many people. Those recurring vaginal symptoms. If you've ever felt like you're stuck on a merry-go-round of treatments that just aren't cutting it, then this explainer is absolutely for you. So let's just jump right into the big question, right? Is this thing that keeps coming back another round of thrush or BV, or is it something totally different? Maybe a pain condition? The symptoms can feel so similar, it can seem almost impossible to figure out what's what. But getting this right, that's the crucial first step. And this is the cycle we're talking about, isn't it? The symptoms show up, you try a treatment, you get a little relief, and then boom, it all comes roaring back again. That feeling of being stuck is more than just annoying. It can really mess with your confidence. If that sounds familiar, trust me, you are so not alone. But there is a clear path forward. And to help light the way, we're going to lean on the expertise of Dr. Farzana Khan. She's a specialist from the Women's Health Clinic, and her whole mission is to bring clarity to these really confusing issues. Dr. Khan has been dedicated to this for over 20 years. You can see her journey right here, from earning her medical degree all the way back in 2003 to now in her role as a key opinion leader, where she's actually training other doctors. That kind of deep experience is exactly what we need to untangle these stubborn problems. And this quote, this really gets to the heart of why her approach works. It's not about just handing you a prescription and sending you on your way. It's about empowering you. Clear explanations so you actually know what's going on, realistic expectations, and making decisions with you, not for you. This is the foundation for everything we're about to cover. Okay, so let's get into the first big clue, the first piece of this puzzle. We have to understand the difference between an infection and a pain-related condition. I know they can feel incredibly similar, but their root causes are actually worlds apart. So on this slide, we've laid out the classic signs for the two most common infections. The differences are so important. With thrush, you're looking for that thick, white, kind of cottage cheese-like discharge, and of course, that really intense itching. But there's usually no strong smell. Now, BV is almost the opposite. The discharge is thin, grayish-white. The itching is pretty mild, or you might not have any at all, but there's that very distinct, strong, fishy odor. Knowing these differences is your first big clue. But what if neither of those really fits what you're feeling? Well, that's when we need to start thinking about pain-related conditions. The key thing to get here is that these are not infections. The discomfort is coming from your body itself, things like sensitive tissue, overactive nerves, or even muscle tension in your pelvis. It often feels more like a dryness, a rawness, or just a constant burning. And this quote from our expert, Dr. Khan, just nails it. Here's the bottom line. Infections are mostly about discharge and smell. Pain conditions are about sensations, like dryness, burning, or a deep ache. And a lot of times there's no weird discharge at all. If you can remember that one distinction, you're already way ahead of the game. Okay, so let's dig a little deeper. If you've been treating what you're sure is thrush over and over, and it's just not getting better, that's a huge red flag. It probably means you're not dealing with thrush at all. You're dealing with one of its imposters, a hidden condition that just looks and feels like it. And this right here is the classic sign of an imposter at work. You feel that itch, you see a little white discharge, you grab the antifungal cream, but instead of getting better, the burning and irritation actually get worse. Does that sound painfully familiar to anyone? If that hit home, you might be dealing with something called cytolytic vaginosis, or CV, and this one is fascinating. It's actually caused by an overgrowth of the good bacteria, the lactobacilli. You can literally have too much of a good thing. It makes the whole environment way too acidic, and that acid starts to burn the sensitive tissue. It's the ultimate imposter because it looks and feels so much like thrush. All right, let's switch gears to that other major frustration, BV that just keeps coming back. That statistic on the screen is just wild, a reoccurrence rate of over 50%. This has nothing to do with being unclean. It's all about the clever survival tactics of the bacteria themselves. And here is their secret weapon, something called a biofilm. Dr. Khan calls it a slime city, which is just the perfect way to picture it. The bacteria build this sticky, protective mesh that glues itself to the vaginal wall. It's like a fortress. Your antibiotics might kill off the bacteria floating around, so you feel better for a bit. But they often can't get through that slime city. So as soon as you're done with the treatment, the bacteria just come back out and start the party all over again.
Okay, so we've talked about the imposters and these sneaky slime cities. The question now is, what can you actually do about it? How do you find that path to clarity? Well, the good news is there are some really practical tools you can start using to figure out what your body is trying to tell you.
And this right here is an incredibly powerful tool you can use at home. Just grabbing some vaginal pH test strips from the pharmacy can give you a massive clue. Look at the chart. If your pH is super acidic, below 3.5, that points strongly to our imposter, cytolytic vaginosis. If it's in the normal range, between 3.5 and 4.5, that suggests it's more likely thrush. And if it's above 4.5, more alkaline, well, that's a classic sign of BV. It's a fantastic first step in playing detective. And along with testing, these simple self-care habits can honestly make a huge difference. First, keep a diary of your symptoms. It can help you find patterns and triggers you'd never notice otherwise. Second, avoid irritating soaps and washes. Warm water is really all you need. Third, stick to breathable cotton underwear. And finally, if you're dealing with any dryness, a good pH-balanced lubricant is your best friend. Okay, now, this is incredibly important. We have to know when it's time to stop the self-care and go see a doctor. Please pay close attention to these red flags. Things like severe pain, a fever, really heavy or foul-smelling discharge, or any bleeding you can't explain, those are all signs to get checked out right away. Same goes for any white patches that don't rub off. That could be a different skin issue entirely. Please take these signs seriously. So, when you boil it all down, it's about listening. Your body is sending you clues all the time about what's really happening. And once you have the right information, like what we've talked about today, you can start to move out of that frustrating cycle and into a place of real understanding and empowerment. So the question is, are you ready to start decoding those clues?